Hi, my name is Beth and I'm going to perform head to toe assessment. So before I do head to toe assessment, I'll have to log onto my patient's room, and then I'll introduce myself. I'll proceed and wash my hands and provide privacy and check for the safety of the room. So the room has safety and I've provided privacy, and then I'll proceed and go to my patient and introduce myself. My name is Beth and I'm here to do your health assessment. Could you kindly tell me your name?
Lisa.
Okay, Lisa. So Lisa, I'm here to do your head to toe assessment, and head to toe assessment involves like touching and doing some escalation on you. Is that okay with you?
Yes.
Okay. So after explaining the procedure to my patient, so the next thing that I'm going to do, I'll check on my patient's mental status and level of conscience. So Rachel, could you kindly tell me where you are? Lisa?
I'm in this room. Hospital.
And what has brought you in today?
A health assessment.
Health assessment. And could you kindly tell me what date is it today? Okay, so I'll proceed and document that my patient is a Latin oriented ×4, and my patient, I've also evaluated her speech. Her speech is clear and her posture is straight and she's dressed according to the weather, and she's clean. Yeah, so after that I'll go, I've evaluated her speech, so I'll also go and I've also inspected her posture and her general, I've done the general hygiene. So the next thing that I'll proceed and do, I'm gonna do the head, ear, eye, nose, and throat assessment. So by doing that, Rachel, I'm going to start by doing your head assessment, and by doing your head assessment, I'm going to touch your hair and inspect. So I'll need some gloves if needed, or I'll just proceed and inspect her head. So Rachel, I'm gonna palpate your head to see if there's any bumpness. So I'll palpate her head. I can't feel any bump there, no lesions or no foreign body like parasites. So her head is intact. And then the next thing that I'm gonna do, I'm going to inspect her face for sensation and movement. That's cranial nerve number 5 and cranial nerve number 7. So Rachel, I'm gonna touch your face. Could you kindly close your eyes? So I'm gonna touch your face and tell me where you felt a touch, okay?
Left cheek, right cheek, forehead, cheek.
So the next thing that I would like you to do, could you kindly close your eyes tight? And then could you kindly clench your teeth? Could you kindly puff your face? So cranial nerve number 5 and 7 are intact. So Rachel, I would kindly request you to remove your glasses, and I'm gonna inspect your eyes for any redness, some discharge or any foreign body. And I'm also gonna inspect your eyelashes. So the eyelashes are full, the eyelid is okay, the sclera is okay, and there's no discharge on the eye, and yeah, I can see any discharge. So the next thing that I'm gonna do, I'm gonna use my pen light to put some light on your face, and then I'm gonna check on your lids, the way they construct, and that's okay. So Rachel, I would like you to look at this object, okay? So I'll bring it next to your eyes. Okay, and then good. And then the next thing, can you still stay there? I'm gonna check on the 6. I'll do a cross, good. And then a cross, good. And then I'll do a T, perfect. And then I'll do this. Okay, so I'll proceed and document that my patients are, the pupils are equal, round, reactive to light, and accommodation. So the next thing that I'm gonna do, I'm going to inspect for extraocular mucus movement. That's cranial nerve number 3, and I'll also perform sensation on your nose. So could you kindly close your eyes and tell me what you smell? I feel like
11.
Okay, and then I'll use my pen light to check on her nose for patency. First, could you kindly close one side of your nose and breathe in? Do that.
Oh,
The other side. Okay, so the nose is midline. The mucosa membrane is pink. No signs of any discharge. No foreign bodies coming out of it. So the next thing that I'm gonna access for the hearing based on our so for the hearing based on our conversation, my patient can hear me very well. Can you hear me very well?
yes.
Okay. And then the next thing that I'm gonna inspect for the sinuses. So I'm gonna inspect for your frontal sinuses. I'll use my thumb to touch. Are you feeling any pain?
No.
No tenderness. Can you take off your glasses again? And axillary. Are you feeling any pain? Okay. So that the sinuses are intact. And then the next thing that so the earring is okay. The eye color is white, pink, white and brown. And then I'm gonna inspect for your hearing. So Rachel, so first I'll palpate the ear for any tenderness or any, and I'll also inspect for any foreign discharge or any foreign body. So the ear is intact. I'll use my pen light to spot inside the ear to see if there's anything coming out, and it's okay. So Rachel, I would like you to close one side of your ear and you'll tell me what you hear me saying, okay?
Hello.
And then close this side.
Hello.
Okay, that's cranial nerve number 8 is intact. My patient can hear very clearly. And then the next thing that I'm gonna check, I'm gonna inspect for respiratory. So by the look of the things, my patient is not using any labor in breathing. He's breathing easily. And then the shape of her thorax shape is okay. There's no barrel shape. And the next thing that I'm gonna do, I'm going to auscultate bilaterally. So I'm gonna listen to your chest. So at this point, I can ask my patient, like, I don't need to escalate it with her clothes on. I'll ask her to take off her clothes. But at this point, I'm going to ask her to take off her clothes. I'll just go ahead and escalate it with her clothes on. So Rachel, what I'm going to do, I'm going to listen to your breath sound. So the next thing that I'm going to do, I'm going to access for cranial nerve number 11. So Rachel, I would like you to shrug your shoulder up. Can you do that? On the resistance, can you do that? Okay, and then can you move your head? Okay, can you move with the resistance? Okay, and then I'm going to check on your carotid arteries, one at a time. Okay, and I'm going to use my stethoscope to check on her carotid arteries, and I'll use the bell side. Okay, so just breathe normally. So I'll proceed and note down that no brutes noted. So the next thing that I'm going to access, I'm going to inspect for the spinal alignment. So Rachel, I would like you to bend forward, or could you kindly sit on a way that I can see your spine? Okay, can you bend that? Okay, and then the next thing that I'm going to do after inspecting for your spine alignment, I'm going to check on your, after your thoracic expansion. So Rachel, as the way you're still seated, could I kindly check on your back and just to see on your expansion bilaterally? And then I would like you to say 99, 99, okay? Could you
90,
can
99, 99, 99, 99, 99.
So, thank you. So the vibration is bilateral, and then so Rachel, the next thing that I'm going to do, I'm going to listen to your heart sound, and it's on 5 points. So I'll start with aortic, pulmonic, abs, tricuspid, and mitral. Okay, and I'm going to look for things like mama, rocky, or strider. Okay. So just breathe normally. So here I'll have to do it when her clothes are off, but I'll just do it with her clothes on. Could you kindly breathe in and out? So no adventitious sound noted, no mama, no rocky, or strider noted. So the next thing that I'm going to do, I'm going to palpate for, I've already palpated for the thoracic expansion. So, and the next thing that I'm going to do, I'm going to listen to her heart. So the next thing that I'm going to do, Rachel, I'm gonna look at your hand for, so I'm gonna inspect her upper extremities. So for any edema, I can see like she has some tattoos, and then I'll check on her capillary refill. Oh, that's good, 3 mm. And then no edema noted. The skin is warm to touch. It's moist. And then Rachel, could you kindly flex your hands? And then could you kindly bring your hands in front? And then could you kindly press my hands very tight as you can? Okay.
Sorry.
And then the next thing that I'm gonna do, I'm gonna palpate your capillary refill for your, okay, okay. That's good. And then your bronchioles. That's perfect.